Dear viewers, let's talk about gastroesophageal reflux disease and lifestyle modifications today. First, let's understand what gastroesophageal reflux is. To understand that, we have to know the gastrointestinal anatomy, especially the upper gastrointestinal anatomy, which starts from the mouth, then goes through the throat and the esophagus and the stomach. When the food goes through the mouth and it goes through the esophagus and then it reaches the stomach, between the esophagus and the stomach, there is a sphincter called lower esophageal sphincter. The problem with this disease is the relaxation of this sphincter. In other words, inappropriate contraction of this sphincter. Let's go on to elaborate some more about this. So this sphincter is affected by the pressures. There are few causes which can cause the lower esophageal sphincter to relax. So the causes which comes through the foods are chocolates, alcohols, cigarettes, caffeine, peppermint, fatty foods, fried foods, citrus foods and spices, and the list is so huge. You may wonder whether all these foods causes reflux. It is not so, and there is an individual variation among people. Nevertheless, these foods are associated with gastroesophageal reflux disease. And some drugs also associated with this particular phenomena. Things like opioids, theophylline, which are used in asthma patients, calcium channel blockers, which are used in hypertensive patients, and some sedatives like diazepam, which are used in elderly people, can cause lower esophageal sphincter to be relaxed more than it is necessary. When the food reaches the stomach, then the stomach moves the food through a movement called peristaltic movement. While the food is moving through the peristaltic movement, it goes through and it goes up. When the lower esophageal sphincter is relaxed, there is a possibility some amount of the food reaches the esophagus, which causes some heartburn. People come and complain that they have heartburn, especially at night. Then we have to see what relieving factors are associated with this lower esophageal sphincter relaxation. Before coming to that, I would like to tell you one more disease which is associated with gastroesophageal reflux disease, a disease called hiatus hernia, where a part of the stomach reaches the esophagus. Then there's another possibility when there is high amount of acid and when the peristaltic movement happens, part of it can reach the esophagus. So what are the problems associated with this particular disease? Especially the symptoms like retching, heartburn are sometimes unbearable. On a long term, the chemical irritation due to the acids, there can be inflammation and it can lead to some disease in the future. That is called Barrett's esophagus, which is a predisposing cause for a cancer. Let's come back to the topic. I have discussed the causes of the lower esophageal sphincter to be relaxed. Then what are the causes which can cause it to be contracted? Especially protein-rich food are associated with contraction of the lower esophageal sphincter. Now let's see the lifestyle modifications associated or advised for the patients to overcome this disease. Number one, don't fill the stomach full. So there is a high possibility that there will be an upward movement. Then do not drink water or any other liquids at least 30 minutes after solid food. Then completely avoid cigarettes and alcohol. And also, you have to cut down coffee and caffeine-rich food. There's a question, how much coffee you can drink? It's an individual question, because some people, even if they take 3-4 cups of coffee, they will not get the symptoms. But for some other person, even a little bit of coffee can cause reflux symptoms. So therefore, food-related things are individualized. Nevertheless, these are the common causes. Then again, the carbonated drinks, you have to avoid or cut down. Then the citrus food and the spices. There's a lot of controversy regarding this. Yet again, there is some individual variations. Fatty food and the fried food are associated with reflux. Then we have to cut down fatty foods and the fried foods. Then it is always better to have small meals if a person is suffering from gastroesophageal reflux disease. It is better to have small, frequent meals than having large meals. Then immediately sleeping after a meal is also associated with gastroesophageal reflux disease. Then obesity and lack of exercise is also associated. Therefore, some amount of weight reduction and exercise is very important. There's a saying in English, after lunch, walk a while, and after dinner, walk a mile. So, these lifestyle modifications will be very useful to overcome gastroesophageal reflux disease. But unfortunately, in some people, it's so severe that these lifestyle modifications will not work at times. In such cases, you have to go to the doctor, and doctors will prescribe acid-reducing drugs and the drugs which can increase the movement of the stomach. But on a long term, that will not be very, very helpful. When it comes to the hiatus hernia, it may not need a surgery at the beginning. You might have to go through the lifestyle modification and weight reduction if you are really obese. And if it's unbearable, there is a procedure called fundoplication. You can go to the surgeon and ask for advice. On the whole, now we have discussed about the gastroesophageal reflux disease, what it is, what are the aggravating factors, what are the relieving factors, and what are the lifestyle modifications. Let's discuss another topic and another time. Thank you very much.